In December 2013, a young boy from Guinea was playing around a burnt tree stump and contracted the Ebola virus, possibly spread by bats. Soon many people in his village were sick, but it took many months to formally confirm Ebola was the cause. The virus spread rapidly, firstly to neighbouring Sierra Leone and Liberia, and then beyond West Africa, including to the UK and the US. Within 6 months there were more than 10,000 reported cases. This was the largest Ebola epidemic ever recorded. Healthcare professionals around the world volunteered to help diagnose and treat patients, while scientists rapidly set up research programs investigating vaccine candidates and new treatments. At the University of Birmingham, we helped establish genome sequencing to understand how the virus was spreading and evolving. We used a new British invention, nanopore sequencing, which gives immediate results and is so small that it can fit in your pocket, enabling the sequencing to take place in the field rather than in the laboratory. These results helped us understand how the virus was spreading. Just a few days after a patient was diagnosed, we could track and trace the likely source of their infection. This gave the local epidemiologists a vital new source of information and complemented their investigations. It was particularly helpful for communities that were resistant to outside help. Nearly 6 months after the last case in Guinea, when the outbreak seemed to have stopped, there was a cluster of new cases. Our analysis showed that this was related to a survivor who had been infected 500 days previously. We could therefore show the importance in monitoring survivors for signs of Ebola recurrence long term. At the University of Birmingham, we are developing genome sequencing as a way of diagnosing and predicting new epidemics by sequencing patients who are sick, even before an outbreak is declared. We've applied the same technique to the Zika virus in Brazil and determined that Zika had been circulating in the Americas, causing millions of cases a full year before it was even considered to be a public health emergency. Pathogens can spread quickly and don't respect borders. The world is vulnerable to a new pathogen, so we need to simultaneously improve our ability to detect them and make vaccines and new treatments for diseases which we may not even know about yet. Our work at the University of Birmingham is showing the way forward for genomic surveillance of threats to humanity, from emerging infectious diseases to the spread of antibiotic resistance. Our pioneering approach to sequencing can be done in real time, anywhere in the world, and the results can be shared instantly with a global community of researchers who are focused on preventing the spread and finding treatments for these major killers.